We've got lovely Amber on the table with consent for filming. So this is part of the FT5D Frontline course. I'm going to be demonstrating some technique applications for the tibiofibular complex with specificity on tib posterior, popliteus, and interosseous membrane. So our first piece here is just now to assess the general roll. This will be done with a bolster and without. So let's pull this out for a second. I'll put it on my here and drop them down. So you can feel, see, I've got more rotation now. So there's stability off that. Flexion allows a different assessment. Usually it's with rotation or torsion at the knee. I want first to feel the femoral head and how it's rolling, because later in this course we're going to reposition this femoral head. See, that's another thing we want to do. So I got a few pieces I've got to teach. You'll check the sleeve surface. Sleeves tend to orient a particular pattern of torsion and rotation, so we call them sleeve twists. We teach a method of ease and bind, so you can see that's the way it's twisted, that's the way it's not. You can feel that. I could just apply static pressure, a compound torsion technique with a direction, and we'd get the surface to change, which I'll do momentarily, okay? Now we're going to feel how tight. So the thing that fascinates me about the deep front line is this is one of the most difficult areas to put compression on and make change to. So I thought of a number of ways to play with this. We just had a loud crack. We don't know what it is, but we're going to keep it on. Hopefully nothing blew up. So I used to use, and I still do use, tuning forks on the tibia because I wanted to vibrate the periosteal tissue and figured the deeper tissue might resonate and relax around a tuning fork. You can use tapping on it, okay, and play with it that way. It also is an assessment tool when you tap. So as an assessment tool, you're going to feel where the bone density is the greatest. Interestingly enough, it's down where the sock is here.
That's quite sore.
Medial, and it's sore even on tapping. So there you know, if you have a bruisey, sore feeling, odds are that is fascial tissue that is dense and holding. Now, so we're doing the rolling assessment. We're doing the surface assessment. We're doing a tapping assessment. We could check the motion at the ankle, and if we see here, the talocural joint at the moment, there's foot movement, but very little ankle movement in this position. When I bolster, there'll be more, but right now, this is what it's showing me. However, here, you're getting a little more movement, but now we check then inversion, eversion, and you'll feel the eversion on that side doesn't want to happen. That's a lateral line fibular head area. So we're talking about a deep front line, but what we see here is we have a surface front, side, and back tension that we may have to clear. This one, she does evert, where on this one, it doesn't as much. Okay, this one doesn't roll easily, so whoever's going to play here is going to have fun. This is really dense and tight. I'm going to, because of filming, I'm just going to go ahead and do this side. Now, we're going to check then torsion. There is more movement at the fibular portion and less movement at the malleolar portion down low. Let's come here. It's opposite, okay? It feels, it's a little equal. It's hard to tell. I'm going to say this, no, there's a lot of density here, so it's sort of hard to tell. Now the main muscle that controls, to a certain degree, tension in the interosseous membrane, there's two main features. The membrane sits between the two bones, the fibula and the tibia, and the muscle over it that just connects to it is the tib posterior. Now the tib posterior is a painful little critter, so what we're going to do is turn you face down for a second, and we're going to go after that first.